you so much. Good morning, everyone. I know previously you all had worked with Oyuki Lucas for both individual under 65 and Medicare, but we did have a reorganization recently, and Oyuki is still your rep for Medicare at Blue Cross, but I'm taking over for under 65 individual. So if I haven't met you all before, nice to meet you this morning. And my contact information will be on the last slide if you don't have it. We'll dive right in to our training for 2026 OEP. And sorry, got to get to that screen to click. There we go. So we are the only carrier on Marketplace that has both a PPO and HMO network of plans that has a 4-star rating. And we do want to mention, as Miranda already did, that all the information in this presentation deck is subject to change pending CMS and DIF's approval. Everything was submitted later this year. Carriers had the opportunity to submit plan changes and rate changes all the way up until September 4th, which is really, really late. So we just have to have that disclaimer out there. So changes for 2026, we are going to see more changes than we have over the past few years in the under 65 space as far as our portfolio goes. We are going to see an increase in our portfolio, which we haven't done in years, but it's a good thing. We are expanding our select network from 20 to 31 counties. And the select network is our strongest network that we have as far as popularity goes, basically because of the network and the premium. It offers a little bit of a lower price point than our preferred HMO network. It still utilizes that preferred HMO networks, hospitals and specialists. It just has a more localized PCP network. So it's really a great opportunity to be talking to members. And we have a map, actually, I'll show you of what counties that's expanded into. We're also offering a few new silver and bronze plans. We have 4 new silver HSA plans, 4 new bronze HSA plans, and then we have 4 silver and 4 bronze plans that have benefits covered prior to deductible. These might be more appealing to those members that might have ICHRA available to them. So we'll talk about those plan designs as well a little bit deeper in the next few slides. If you guys haven't heard about the expanded HSA eligibility, that is one thing that is good for all of us and good for our members coming into 2026. So any bronze plan and then any value plan, which is our catastrophic plans, the value or catastrophic plans are available to individuals under the age of 30. They're basically very similar to a bronze plan, but have a lower price point for those younger members. But all of those bronze and value plans will be HSA compatible, even if they have those first dollar benefits. So even the bronze extra plans that have copays on PCP visits, specialist visits, things like that, you're going to still have HSA compatibility. So it's good for these members to be able to have those lower price points, first dollar coverage, and be HSA compatible. We are seeing an increased out-of-pocket maximum change, which we see year over year, unfortunately. So that for an individual is going from $9,200 up to $10,600. That doesn't mean all plans will follow suit with that, but some will. All right, so let's take a look at the network. So as you know, the Premier PPO and the preferred HMO networks are available statewide. The Select HMO network is the network that is expanding. So you can see it's expanding. Typically, it was more popular in like Southeast Michigan. We did have a few counties over on the west side, but that's expanding even more into the west side, and then up into a few counties more up north on the west side as well. So it's offering that lower price point to some more rural areas, giving them more plan options and more plan options for you guys to sell as well. And then we still do have our BCN local HMO network, which is in Wayne, Oakland, and Macomb County only. The local network partners with Ascension and Trinity hospital systems. So it is a very narrow network. It's just to compete with those other carriers that have some of those more narrow networks as well, and give the lowest price point option available to the members. We are discontinuing the Metro Detroit network for 2026. The Metro Detroit network was also available in Wayne, Oakland, and Macomb counties, same as the local, and it was a narrower network, but it was pricing out either the same as the Select HMO or higher. So it didn't make sense to offer it when the Select HMO network has a substantially larger network, right? So it was underperforming, and it just didn't make sense to keep it. With our HMO plans, we do require written referrals as a rule for members to see specialists. However, with our Select and our preferred HMO networks, if the member's PCP and specialist are in the dark blue counties you see on this slide, they do not require a written referral. And it's not based on where the member lives, it's based on where the providers are. So if they have a PCP or specialist in the light blue counties, so it's southeast into the thumb, into mid-Michigan, those counties still do require a written referral. And this is for the Select and preferred HMO networks. And if you guys have any questions, I'm sorry, I meant to say this in the beginning. If you guys have any questions during the presentation, feel free to come off of mute or feel free to enter it in the chat. We can also address questions at the end, however you feel comfortable. So as I mentioned, we are closing our Metro Detroit plans for 2026. We will be crosswalking those members. So if you have members in these plans listed here, we will crosswalk them for you on and off Marketplace. And you will remain AOR. So if you let them passively get crosswalked over, your agent information will stay intact. For the most part, these members are getting crosswalked into the exact same plan. So 3 of the 5 plans listed here, they'll be crosswalked into the same plan. It's just the larger Select HMO network. And again, the Metro Detroit was pricing out about the same or higher than the Select. So it shouldn't be like a shock in price in premium difference. We do have listed the preferred HMO value on the slide. That plan is closing in 11 counties. It's not closing altogether. It's closing because of the Select network expansion. With the value plan, which is our catastrophic plan, we don't offer the preferred HMO and the Select HMO value in the same place. So we either offer the preferred value or the Select value. Because the Select is expanding into those 11 counties, the preferred will be closing. The preferred members will be crosswalked into the preferred bronze secure to keep them in that same network of doctors so they don't have any disruption with their PCP specialists, etc. However, if you have members in that plan and you want to reach out to them, they do still have the premier PPO value and the Select HMO value available if they want to go into like a lower priced product. So here's kind of a breakdown of what our new plus plans look like. Our plus plans are going to have benefits covered before the deductible. Again, this might be for members that are used to having a group plan where they have office visits covered before deductible. So if you look at the silver plans, the PPO and the HMO Silver Plus basically have the same copays. There's just a little bit of difference in the pharmacy copays, but they both have a $6,100 deductible, then 20% coinsurance with that out-of-pocket maximum of $10,600. Before deductible, they're going to have their PCP copay at $30, specialist visits. With the PPO, it's going to be after deductible, $60. With the HMO, though, it's covered before deductible, $75. Urgent care is covered before deductible at $40. And lab work would be a $20 copay before deductible. So anytime you see BD, obviously that's before deductible. AD is standing for after deductible. And then you have generic drugs covered before deductible, and then any brand or specialty drugs covered after. So this plan at the Silver Plus level for our HMO has more items or services covered before deductible than any of our other plans. You've got your PCP, specialist, urgent care, lab work. generic drugs, all those items are covered prior to deductible on that HMO Silver Plus. And then if you look at the Bronze Plus, that deductible is a little higher, obviously at $8,500. The coinsurance is at 50%. Out-of-pocket max still at $10,600. So really there, you're looking at, yes, the deductible is higher, but the out-of-pocket max is still the same. And we're going to be looking at premiums and what the difference is there, obviously, when we're quoting the members. With the Bronze HMO plan, you're looking at a $30 office visit copay before deductible. Specialist, though, is covered after. So if specialist visits are important, then you might be looking at the Silver plan. The urgent care, it's still covered before deductible. Lab is still covered before deductible. So you're still getting a decent amount of benefits before deductible, including generic drugs. So these plans are going to be heavy in first dollar coverage. Our other plans that we're introducing are the HSA plans. And I know we already have HSA plans. And I'm sorry, I also wanted to mention the new plans that we're introducing that we're talking about on these slides are available off market only. So these HSA plans have a bigger spread between deductible and out-of-pocket max. So currently, our HSA plan offerings, they typically have the same deductible as they do out-of-pocket max. It's like once you hit your deductible, you've hit your out-of-pocket max. So they're very high deductibles. With this, you're going to see a lower deductible. At the Silver level, you're going to have a $3,500 deductible, 20% coinsurance, and then an $8,500 out-of-pocket max. With the Bronze, you're going to have a $5,500 deductible, 30% coinsurance, and then that $8,500 out-of-pocket max. So again, still the same out-of-pocket max, regardless if you're at the Silver or Bronze. It's just, do you want the lower deductible or the higher deductible? Do you want the lower premium or the higher premium? So again, just basically a math problem. You guys know how it works. Oh, sorry. Thought I turned my ringer on silent. Just some things that we like to point out about all of our plans is that with all of our plans, members are getting their $0 annual visits, their wellness visits, their vaccinations. We also offer a $0 copay for diabetes test strips, lancets, and devices. And we'll talk about how they would get those devices later on in the presentation. We also have a $0 mental health self-guided support by Teladoc in our behavioral health app. We'll talk about all of these $0 benefits throughout the presentation. We have a maternity program, a cancer program, a Blue Cross Health and Wellness services through WebMD. There's discounts at gyms, nationwide coverage, 24/7 virtual visits in our Teladoc app. Members have access to urgent care. Nationwide, we have a 24-hour nurse hotline at no cost to all of our members. And then we have our Blue 365 discounts. So a lot of benefits that all of our members get regardless of the plan they enroll in. And just some things I like to point out on this slide with our HMO plans, because our HMO plans typically do have more benefits covered prior to deductible than our PPO plans. And most agents are selling our HMO plans over the PPO plans anyways. But a lot of our HMO plans have a $0 copay on lab and pathology tests. Not all, there are some exclusions as noted, but many of our original HMO plans do have that $0 copay for lab and pathology, which is, I think, unique to BCN and a huge benefit to our members. Some of our insulins that are actually brand named insulins, like Lantus, Novolin, those things are considered a tier 1A with BCN. So those plans that have copays for generic drugs or a tier 1A before deductible, those insulins would fall into that category, even though they're technically a brand. We do have the same copay for both PCP and mental health visits on our plans. So if a member has a $30 PCP copay, they would have that same copay for seeing a mental health professional. We also offer retail health visits on our plans, which is like your CVS Minute Clinic, and that's going to be at that same copay as a PCP visit rather than an urgent care visit. So just some ways to make benefits a little bit less expensive for our members. When you guys are using our Find a Doctor tool, I just want to mention a couple things. I know that everyone likes to search by I don't know my plan network because you don't want to have to search for through every network. I understand that. However, when you're looking up someone's primary care physician, if you don't put in the network, you're not able to see if how they're contracted with us, which is important, very important for a PCP. You need to ensure they're contracted as a primary care physician so that when that member enrolls, they can select them as a primary care physician. So it's important to, in the right-hand corner, choose the network of the plan that they want to enroll in and search for their primary care physician that way. And when you see that, it will indicate either in green, I'm a primary care provider, or in red, it will say not a primary care provider. If you don't select the network, the system can't tell you because they don't know what network you're looking at. So for the most accurate results, you want to choose the network in the upper right-hand corner. Obviously, the location you want to make sure is accurate. I know that defaults when you go into a certain location. So you want to make sure you're updating that. And that, I think, is the most important information that I would give you guys on this. And if anything ever looks funky on the Find a Doctor tool, if you're like, there's no way this doctor doesn't take Blue Cross, I talked to their office, they said they do, you can reach out to me and I can verify with the provider team. With our pharmacy benefits, just a few things to note. We do have 2 different formularies for our PPO and HMO products. So the links are listed there, but if you need me to send them to you, I'm happy to do that. We do use Optum RX. So with that, that's who they would do any mail order through. And we also have an exclusive agreement with Walgreens Specialty Pharmacy for any specialty drugs. So if you have members that are on a specialty medication or need to be on a specialty medication, they do have to go through Walgreens Specialty Pharmacy with us. All right, so we're going to talk about health savings accounts. There's a lot of change with that this year. We do offer health equity as a free benefit to our members. So that's for any members enrolled in a plan that's HSA compatible. Obviously, they'll have access to health equity. They do have to enroll with health equity. They can do that either at the time of the application by indicating it on the app, or they can call into customer service once they're enrolled, or there's also a PDF paper application they can submit. But that is free for our members. They do not have to use health equity if they already have a preferred financial institution they want to set their HSA up with. That's totally fine. But the nice thing about health equity is that members can actually access it through their bcbsm.com member portal. So they'll have access to both their Blue Cross or BCN member information along with health equity all in one place. Again, the eligible HSA plans have expanded. So we have our previous HSA plans, we have our new HSA plans we introduced, and then we also have all of our bronze and all of our catastrophic or value plans that are compatible now within HSA. So the contribution limits did change. They always change a little bit from year to year. So for an individual, it's now $4,400. Obviously, there's still that $1,000 catch-up if they are over 55. And then it lists out all of our plans that are now compatible with HSAs. All right. So dental and vision plans, we do offer year-round enrollment for dental and vision. So if they don't enroll during open enrollment, that's fine. They can enroll anytime. And the way it works is, say it's today, September, they have all the way until September 30th to enroll for a 10/1 effective date. Please keep in mind that you have to select, I'm enrolling in dental only, I don't have an SEP, for it to go through unless they have an SEP or unless it's OAP, right? A lot of agents miss that and they just select other, or they'll select loss of group or something random, and then it doesn't go through because they don't submit supporting documentations. And agents call and say, Erin, that's supposed to be available year round, but you actually have to submit the application that way. Otherwise, underwriting is just gonna look for documents. And if they don't get them, they deny the app. So make sure you're selecting the right button. With our dental plans, nothing is really changing for next year. Just a few things that I want to mention, if you're not aware. For non-pediatric members or for adults, they do have a maximum allowable amount. So for instance, if they were on the standard plan, the 170/50, the in-network annual maximum is $1,200. That's the most Blue Cross would pay towards their dental work, anything covered on the plan. For pediatric members, it's a nicer benefit because they have an actual max out of pocket. So in-network for one child, their max out of pocket would be $450. So any covered benefits, the most that they would be responsible for would be $450. And then Blue Cross would cover them after that at 100%. Sorry, I just saw a question come in on the chat, so I was trying to read it. If they already have, I couldn't see the end of it, but if they already have health equity and they're new to BCN, they would keep that same health equity account, but they would just have to notify health equity that they're now with Blue Care Network. I think that was the question. If not, I'll circle back to it.
No, I think that did answer the question.
Okay.
There's one more here. Is it true that pediatric dental is no longer a requirement for small groups?
So I can't answer that because I don't work in the group space, so I'm not sure on that.
Okay.
Oh, and I did want to mention on dental too. Usually I have a slide on this, but they don't this year for some reason. We do have waiting periods on the dental plans. So it's right away they have access to preventive, right? They can get their cleanings, exams, all that fun stuff. Class 2 services have a 6-month waiting period, and Class 3 services have a 12-month waiting period. However, if they're coming off of a comprehensive dental plan, it doesn't have to be with Blue Cross, it could be with Delta, it could be with whoever. We will waive waiting periods if they can provide documentation showing that they have that dental plan for 12 months or more, and that there wasn't a gap in coverage greater than 60 days. So you would need a document with the start date and end date, and then I can tell you where to send that. There's actually an email address. Probably that's too long to say. So if you come across that, just reach out to me. I'll tell you what you need and where you need to send it. For children, they don't have any waiting periods. All right, vision. So we do offer different vision plans. With our packaged vision plans, that refers to the plans that are combined with a dental plan. So you can sell dental and vision together, or you can sell them separately. They use the VSP network and probably have the lightest benefits. Or you could do the standalone vision plans, and you have two options with those. One is where the naming conventions are pretty basic. It's like standalone vision with contacts or glasses, where they have an allowance for one or the other, and that's through VSP at a little bit of a lower price point. Or you can pay a little bit more and you can get the standalone vision with contacts and glasses, so they get an allowance for both, and that's through Heritage Network. And if you look here, because I get this question a lot, VSP, when you go to their website, you're going to be selecting the Choice Network. And if you go to the Heritage website, you're going to be selecting the Essential Network. So again, with the VSP network, it's a little bit of a lower premium. They can get an allowance for one or the other for contacts or glasses. But with the Heritage plan, you pay a little bit more, but you get an allowance for both. So it's nice. And both networks are accepted pretty widely. So value-added services. So with our plans, not only are we covering the basics, right? The PCP visits, the specialists, the prescription drugs, but we also have additional services available to our members at no cost. One app that I would encourage all members to download is the Teladoc app. The Teladoc app has a lot within it. They've got access to virtual urgent care, and that's available to them 24/7. So if they're sick in the middle of the night, obviously it's not like an ER situation. Maybe their kid woke up and has, an earache or whatever it is, and they need to talk to a provider, maybe get a prescription called in they can pick up in the morning. They can do that. Typically, they can see someone within a few minutes. Most of the time on our plans, it's a $0 copay. With those plans that are a traditional HSA plan, it's going to be covered after deductible, but it's still a low cost within the app. There's also mental health available within the app. And that's nice as well. It's a little bit different. It's not like you can speak to someone within a few minutes. You're actually going into the app, you're choosing a therapist based on, their profile and what fits kind of like what you're looking for. There's psychiatrists, there's psychologists, there's family therapists, counselors. So you can go through, figure out who you want to talk to, who's going to meet your needs, and you can schedule a full 45-minute appointment with them. And that's someone that you can continue to follow up with. You're not going to get a different person every time. Also with our PPO plans, I want to talk a little bit more about our PPO network right here, because I want to make sure everyone understands it. It's not like a traditional PPO group that we're used to, where you can go out of state and access the Blue Cross nationwide network of providers and have in-network coverage out of state. With our Blue Cross individual PPO plans, while you do have coverage out of state for urgent and emergency care as in-network, when you're out of state, it's going to be out of network, even if you're seeing a Blue Cross provider. The benefit of seeing a Blue Cross provider out of state is we have contracted rates with them, so they're not going to balance bill. However, it's still out of network, subject to the out of network deductible and co-insurance. And the out of network deductible and in-network deductible do not contribute towards each other. So they're going to have an increased liability as far as their out-of-pocket maximum and deductibles go. There are exceptions to that rule. If someone lives in Michigan and they have to go out of state to get a procedure done that maybe can't be done in Michigan, there's different scenarios like that where they could get an exception. There's a form we have, it's called a PPO out-of-state exception form, and they have to have that filled out by their primary care physician in Michigan and have it approved prior to them having services done out of state. That's the only way they would have something that's not like an emergency or urgent care situation covered as in network out of state. Okay. We did want to come up with something for our PPO members that maybe are snowbirds, they're not at Medicare age yet, but they still go into Florida, or maybe they have college students out of state. With our PPO plans, we created within the Teladoc app a virtual primary care program. So it's different than the urgent care virtual visits where they're just like not feeling well and need to talk to whoever, within a few minutes. They're actually choosing a primary care physician within the app. And that's their primary care physician and their primary care physician team. So they could do a physical through this app. They could schedule ongoing visits if they were managing like a condition. This provider will manage their prescriptions and prescribe whatever they need, and they can access those prescriptions out of state. That's fine. But it just gives them more of a one-on-one actual relationship with a primary care physician, even if it's virtually while they're out of state, and it gives it to them at the in-network cost. Any questions on that, just let me know. Also within Teladoc, so same app, there's also our solutions for diabetes, pre-diabetes, hypertension, and weight management. I think our most popular one that everyone always has questions on is the diabetes solution. And that's where I mentioned earlier, members can have their meter, test strips, and lancets at no cost to them. This is how they would do that. So they go through Teladoc, and they would be able to get that smart blood glucose meter, which is a $200 value at no cost. And it doesn't matter if they're on an HSA or non-HSA plan. This is available to all of our members. And then they get unlimited test strips and lancets shipped right to their door, and that's based on usage. So the more they use, the more they're going to get, right? They're not going to be short. They don't have to go to the pharmacies, get a prescription, and all that stuff. Everything's going to be done right through the Teladoc app, and it just conveniently gets shipped to them. We also have our cancer program. It's our cancer support program, which is accessible through OncoHealth. So it's another virtual platform we have, again, for all of our PPO and HMO members. This is a really nice program. The thing that I appreciate the most is the 24/7 on-demand virtual access to a team of oncology nurses. So if they're in between appointments, or if it's the middle of the night and they can't sleep, either they are, have anxiety about something, they have a new question on a new symptom, they can talk to an oncology nurse right then and there and not have to wait until the next day or until their next appointment. There's also weekly mental health sessions with therapists who specialize in working with people who are going through cancer. There's a nutrition series, a digital tracker, a peer mentor community, so they can have contact and talk to people that are going through the same battle that they are. We also have our coordinated care app. This is a mobile app for members and their families, and a web-based dashboard for care management teams. There are daily health checklists, and members do have to qualify for this program. They can't just opt in. And our coordinated care nurses would reach out to eligible members. We also have our Maven Maternity and Menopause Virtual Support Program. This offers comprehensive personalized digital care that provides clinical support and an educational app that guides members through their entire journey. This is available for pregnancy and up to 3 months postpartum to help them transition back into the workplace. Pre and postnatal support, NICU support, high-risk pregnancy management, and then also the menopause solution, on-demand coaching, second opinions, dedicated mental health support while going through this. So again, this is available for all of our members. The other app that I would download in addition to Teladoc is the BCBS mobile app. The BCBS mobile app is very, very easy to use. It gives them access to their ID card virtually. So if they just enrolled and they can't wait for their physical copy, they have access to it there. They can enroll. I have a slide on how they can enroll, but they can enroll using their SOCH number if they don't have their ID number yet. Also, if they've misplaced their card, which I've done numerous times, and you're at the doctor's office and for some reason they want a copy of your card every time you go, you can just shoot this over to them via email. You can order a new ID card through the app. You can track where you are at meeting your deductible and out-of-pocket max. You can update your PCP here, and you can access all of the additional benefits that we have. We also have a WebMD wellness app where they can schedule lifestyle coaching, read different health topic articles, set up reminders to stay active and eat healthy, and just stay on top of things. Also within the app or within the member portal, whether they're going through the app or they're just logging in through their computer, they have access to Blue 365, which is a really, really great website. You guys can actually go to it without being a member just to view the discounts. You just can't get the discounts unless you log in as a member. But so there's discounts on apparel and footwear. There's discounts on Disney. I just sent those to my mother-in-law because we're planning on going next year. There's discounts on like Zoo memberships. There's discounts on gym memberships is the most popular one. It kind of works how Silver Sneakers works, where you plug in your zip code and you find participating gyms, and you can choose from any of the participating gyms, and it's $28 a month currently. So that's a nice benefit. My husband utilizes it and he gets access to the LA Fitness. That would have been $48 a month otherwise. So definitely some good deals within this site. And then also within our website, within either the mobile app or just going to bcbsm.com, members also have access to a ton of other well-being things like the health assessment, symptom checker, instead of just going to Google and scaring yourself. There's mental health podcasts, healthy recipes, health trackers. There's a ton of WebMD stuff in there. So it's just a lot of stuff within our member portal. So post-enrollment, what to expect after you guys enroll your members. So this year, we still do have that extended open enrollment period that runs through January 15th. Obviously, to get a January 1st effective date, you've got to submit the enrollment by December 15th. Any enrollment submitted 12/16 to 1/15, members will have a 2/1 effective date. We do send out mandatory notices in October, a little bit into November, but most of them go out in October. We also send out a notice on November 30th to members that haven't actively enrolled in a new plan, just letting them know that they will have continuous coverage. As long, even if they don't do anything, they'll still have continuous coverage. So that goes out on 11/30. And then our invoices go out for BCN on December 5th and for Blue Cross on December 8th. And those are for the 1/1 effective date, and they are due on December 25th. Please note that members have a 30-day grace period for that first binder payment. So even if they're on Marketplace and they receive a subsidy, that first payment for January has to be paid within that 30-day grace period. Once they make that payment and effectuate coverage, if they're on Marketplace with a tax credit, they then will have a 90-day grace period moving forward. All right, so there's been a lot of talk this year on all of the changes or potential changes we're going to see. Right now, the only one that's effective is that first line item you'll see there. It went into effect 8/25, and that change was special enrollment periods end for individuals at or below the 150% FPL. So that 150% federal poverty level SEP is discontinued effective 8/25. So that impacts any individuals under the 150% FPL. They now do need to have a valid SEP to enroll outside of open enrollment. Everything else right now has been paused. We're just waiting to find out what happens. The biggest concern I think agents had was that $5 rule for consumers with a $0 plan. So right now, still paused. We're still waiting to find out if that's going to happen. But basically what that was, if you're not familiar, is if members had a $0 premium plan, they did have to actively renew their plan. Otherwise, they would have a $5 monthly premium until they went in and updated their application. So just some things that would impact how we approach open enrollment. We're just still waiting on that. We don't know exactly when we will know. So just so you're familiar with what happens once your member's enrolled and what their onboarding journey looks like, we do send out 5 emails if an email is provided, which is nicer than if an email is not provided, we send out just one big welcome packet in the mail. Whereas this way we can kind of break it up and make it easier to read. So email number 1 usually comes to them within 4 to 6 days. It confirms their plan name and their effective date selection, gives them information on their member ID card. Email 2, and gives them directions on how to register for the member portal, do all their auto pay and paperless billing, which we'll talk about. Email 2 gives them an overview on health insurance terminology. Email 3, sent a few days later, gives them a new member enrollment survey. Email 4, which comes 7 days later, is just tips on what to bring for their first visit to their doctor. And then the last email, which is 7 days after that, is going over their health plan benefits and features and various content based on their plan they've enrolled in. Paperless billing. So if you guys didn't see the alerts we've sent out, we did move to paperless billing for our under 65 members August 1st. So anyone that had an email address on file with us or had registered for the member portal did get moved to paper billing. They do have the option to move back to paper invoices if that's what they prefer, but they'd have to call into customer service or go into their member portal to elect that. Otherwise, they've been moved to paperless billing as of 8/1. There are some exceptions to that. So if it was a pediatric only contract or child only, an on-market member with no tax credit, or members who did not have a member portal or email address on file, obviously we did not move them to paperless billing. because we don't have a way to send them a bill. So there are some caveats to that. So this is where a member would go to register. They just go to bcbsm.com, the same place that you guys go to log into your agent portal. They can go there to register. Again, they don't necessarily need their enrollee or contract number. They can use their last 4 digits of their social number if that's easier for them. And then they can view their, again, ID cards, they can view their plan benefits, all the stuff we talked about. So it is very beneficial for them to enroll into the member portal. It eliminates calls into customer service, which are a headache. It eliminates calls to you guys. So it's just good for the members to have access to. For payments, members still do have the option to make payments over the phone. They can actually text to pay now. They can pay online. They don't have to log in. There's a one-time payment option if they don't have a login. Otherwise, if they do log in, they can set up ongoing EFT that way. And please note that as an agent right now, you do not have the option to set up ongoing EFT. If you submit the application and you select EFT and you enter in banking information or credit card information, that is for the binder payment only. So that would take out their first month payment and effectuate their coverage, but coverage after that, they would have to make monthly payments or set up the ongoing EFT themselves. So please make note of that. And then members can still send in payment by mail, but they need to make sure they're sending it in with an invoice. So a lot of times they might just send it in and not have the invoice with it. And then it takes forever because we don't know where to apply it to. And then they have to try to figure out where to apply that payment to. So if they aren't getting a paper invoice, make sure they're printing one off, or make sure if they're going to pay that way that they switch back to paper billing. But again, not the payment. It is, like snail mail. So it can delay us getting the payment and the payment posting. So depending on when they're mailing that in, that could kind of like jeopardize their coverage. So obviously the preferred method is online or over the phone or text to pay. All right, so a few agent updates and then we can wrap things up and go over any questions that might be outstanding. So we did send out an alert, I think it was last week or the week before, regarding commission changes. Not anything huge, but we are reducing the HMO new member commission from 6% to 5.5%. Everything else is staying the same. The renewal for HMO is 3%, which is exactly what it is today. For PPO, it's remaining at 4% for new, 2% for renewal, which again is what it is today. So the only thing that's changing is new business for HMO members. We also implemented a new agent support request feature in the agent portal. So if you need to update your commission payment designation form, that's where you have commissions deposited into. If you need to change your name, if you need agent reassignment, which is referring to like a transfer of a book of business, maybe you're retiring and you're selling your book to someone else within the agency and you want to transfer your business over there, you could do that through the portal. If you are updating your GA2 digit and you want to do that, you do that through the agent portal as well. We are in a blackout period for that right now, though, so that reopens February 1st. Let's see. And then we did have, hopefully you guys have logged into the agent portal and agent community recently, but I know we launched the new agent portal this year. I think it was earlier this year. Maybe it was the end of last year. It all kinds of runs together. But we also recently did a refresh or update to agent community. So it kind of follows suit with the agent portal update. I actually like the layout better now. I know anytime there's change, it takes a minute to adjust, but it is a little bit simpler when you log in to see where you're going. So right away, there's just one big quote and enroll button, whether it's under 65 on or off market, whether it's Medicare, you're just hitting quote and enroll and then it'll direct you. There's your book of business button. You have a create a case button. So if you have an issue that you need help with, Maybe you submitted an app, but you don't see it yet. Maybe you had a typo on an application, and you need to update something. Um, you need some type of exception. That's when you would create a case. And then there's the report button, which is all the way to the right. The report button is a great button. This is actually where I would go if you wanted to view your book of business. I like the book of business report better than the book of business button that you see. With the report, you can click on your book of business and actually export it into an Excel, and it has a ton of information on it, including members' email addresses. So if you needed to do like an email blast and you needed to go gather all of your members or clients' emails, you can do that from your book of business report. Also within that report tab, you're going to find like the mandatory notice report. Um, uh, there's a report for individuals who are aging off their parents' plan this year, turning 26. So I would definitely go in there and view that. There's also late payer report. So a ton of great stuff for you there. And here is my contact information. If you guys ever need to reach out to me, I'm available by phone or email. Any questions you guys have, please let me know. This deck will be loaded in Agent Community under the Libraries tab. I don't think it's there yet. They were waiting for everything to be finalized and then they were going to upload it.
Wonderful. Thank you, Erin. I
Yeah,
did
of course.
a question. There's so many extra benefits, the different programs and stuff in there. Are there agent handouts or guides that they could download so when they're presenting these plans, they're not missing some of that info, or is that stuff more just sent directly to the member?
Yeah, so I got a quick peek at our plan comparison guides this year, and they do have all of it up at the top, just kind of like high level overviews of the different programs. So that's something they could share that would just be easy for them to hand out. But we also do have some like one pagers on the different programs that I could share with you as well that are like in PDF version.
Perfect. Thank you. And if anyone has any questions, feel free to unmute or throw it in the chat. But that was great, very thorough. Not a lot of changes. I like the new plans and expansion is fantastic.
Yeah, I think it'll be a good year. Usually we have some slides on the kind of like us versus the competition, some competitive slides, but because there were so many changes all the way through September 4th, we didn't have that information available quite yet. But as far as rate increases go, you're seeing like the industry average right around 16%, which is where we landed roughly with BCN. So we are going to be experiencing some rate increases this year, but as far as where we stand competitively, we think we're going to look pretty good.
Fantastic. Wonderful. Melinda has a quick question in here, kind of
Sure.
back to one pagers. You mentioned you can send those over. Is that something that they could also download um, in the agent portal?
I don't know if they're there, but you know what? I'll get them loaded there if they're not.
Perfect. Thank you.
You're welcome.
All right. Well, I think we're good. Thank you so much for your time. Appreciate
All
it.
right. Thank you guys so much. I appreciate you all joining this morning and looking forward to working with all of you and meeting you guys in the future.
Fantastic. Thanks, everyone. Have a great day.